every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative, and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth, and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
Hello, everyone. My name is Eric Nation. I'm the Director of Training and Development for the National Alliance for Drug Endangered Children. And prior to joining National DEC, I was in law enforcement for a little over 20 years, spending the majority of my time in the narcotics division.
Good morning and good afternoon for those of you in different time zones. My name is Stacy Reed and I'm the Director of DEC Network Development for National DEC. And prior to coming to National DEC, my background is many, many years in the child welfare field, focusing at different levels. So welcome, and I'm hoping that this will excite you and get you more involved in your local community and your state.
Let's give you a brief overview of where the DEC mission had started. When National DEC had first originated, it really started around the meth labs. And when meth labs were popular, it was very much so law enforcement driven. It all was based around children being exposed to the meth labs and the contaminations that they were faced during those times. And law enforcement was then identifying children and then moving on to working with prosecutors and child welfare. And in the early stages, it was very much law enforcement, prosecutor, and largely about removing children from these dangerous lab or drug environments based around meth labs.
Well, where we are now, because it's definitely expanded and evolved across many, many years. So where we are now is that we're not a law enforcement driven mission. It can start with any discipline. It can start with teachers. It can start with child welfare. It can start with medical. It's also a community driven mission, knowing that it's going to take all of our disciplines to help impact these children in a positive way. No response driven, meaning that it can start with the identification. It can be proactive and not reactive, and expanded to all the disciplines. And when we say all the disciplines, it's any discipline that can come in contact with children, because it's going to take all of us to impact these children's lives in a positive way. The DEC mission now includes identifying the children at the earliest point possible, responding to them differently, and providing intervention and different types of services that are more targeted toward the children and the families. Also, this mission may not include doing a removal of children. So I know when we first started DEC efforts, that removal was really necessary because these children were living in dangerous lab environments, and we know that that's not necessarily the case anymore. So it may not include removing a child. It may include just working with the children and the families, making sure that they're getting their needs met. Also includes all disciplines working together in the best interest of children and families. So just to kind of give you some of the information, and this is part of our core DEC training, the next handful of slides. So National DEC's mission is to change the status quo by empowering practitioners to identify and respond to children living in dangerous drug environments. You guys already respond in some way. We are just hoping to get you to think outside the box as to how we can look at this differently, how we can respond differently, how we can identify these children at an earlier point, and how we can change the trajectory of these children's lives in different ways. When National DEC became a nonprofit years ago, we knew we had to get everybody on the same page and define what drug endangered children are. So we define drug endangered children as children who are at risk of suffering physical or emotional harm as a result of illegal drug use, possession, manufacturing, cultivation, or distribution. When we started, we thought that that encompassed everything, but what we realized is that there are lots of legal substances that also impact parenting and place children at risk. So we then added that they may also be children whose caretaker's substance misuse interferes with the caretaker's ability to parent and provide a safe and nurturing environment. So moving forward, when we talk about DEC efforts or drug endangered children, we're talking about any substance, whether legal or illegal, that impacts parenting and places children at risk. So we are talking about marijuana, we are talking about alcohol, we are talking about prescription drugs. We're talking about any substance that impacts parenting and places children at risk. If a parent is huffing paint and that's impacting their parenting and placing children at risk, we're talking about that as well. We also knew that we had to bring people together with a common vision, something that we can all focus on, give us a light at the end of the tunnel and keep us moving. So our vision is 100% healthy, happy, and safe children. Now, we know that we're not going to get to that 100% in my lifetime or your lifetime because substance abuse has been impacting children for many, many years, and it's not going to go away. But if we don't start getting on the same page and focusing on 100% of the children, there are going to be many children continuing to fall through the cracks, and that can no longer be acceptable. So with that being said, 100% can also be that you as professionals and as community members also give 100% of you when you come in contact with a child and their family. And we're not talking about spending lots more time with children. We're not talking about spending more money. We're really just talking about thinking outside the box as to how we can impact children when they are present with us and when we come in contact with them in different ways. And it can be that you are sitting on the floor doing the interview instead of sitting at a table. It could mean that maybe law enforcement is assigning a DEC officer when they do a search warrant, somebody that can focus on the child and impact them in a positive way, because we know that that can be very traumatic. Thinking outside the box as to how we can impact these children and move them towards that 100%. So what are we talking about? How many children are actually being impacted? Is it a little bit? Is it a lot? So we know that 1 in 8 children live in households with at least one parent who has a substance use disorder. We also know that 1 in 10 children live in households with at least one parent who has an alcohol use disorder, and 1 in 35 children live in households with at least one parent who has an illicit drug use disorder. So when we talk about these statistics, keep in mind that these are only children and families that have been identified by one of your systems. So whether it's identification through law enforcement, through child welfare, through the treatment providers, we know that there are a lot of children and families who haven't been identified, but this will kind of give you an idea of how many children we're talking about.
We also know that children whose parents abuse alcohol or drugs are also 3 times more likely to be verbally, physically, or sexually abused. Many of us understand what verbal, physical, and sexual abuse looks like. We also know that these children become 4 times more likely than other children to be neglected. When we bring up this statistic, myself personally, as I was going through my law enforcement career, had to take a hard look at this. As many of times that I had frustrations and disciplines have frustrations with other disciplines, one of my biggest frustrations early on in my career, pre-DEC, was with child welfare and not understanding, and the frustration that came with talking different languages. So my challenge to you is, do you know the definition of neglect by your child welfare standards? We all have our idea of what the definition of neglect is, but do you really understand the definition of neglect by those disciplines and practitioners that are assessing the risk and safety around neglect on a daily basis? And that would be, do you understand the definition of neglect by your child welfare standards? We also know that children of parents with substance use disorders have a higher likelihood of developing substance use problems themselves. This is kind of that children see, children do. And I'd like to give an example of myself in my law enforcement career. These were the children that we would run across on a daily basis during a traffic stop, a search warrant execution, or however we may have come in contact with them. And oftentimes we would pick these children up and hand them off to our partners. And commonly what would go through my mind, not out loud, but through my mind was, I'll see you in 15 years. We don't take the opportunity to look at these children and tell them in our minds or even out loud, I am going to do everything in my power to change the trajectory of your life starting today. So we know that children plus drugs equal risk, with some kind of risk affecting all children in some way when you have the children and the drugs combined. Risk is the chance of something going wrong. That danger, that injury, damage, or loss may occur. We also know that all drug endangered children are at risk, but how much risk and for what varies. As this might not be in our scope of work for our discipline, we have to understand that there is a discipline or disciplines out there that are assessing that risk on a daily or by each event that is occurring. And it might not be all of our jobs to assess if it's high risk or low risk, but our jobs are to provide as much information and evidence possible so those other disciplines can make that proper assessment.
How do we get to that 100% we were talking about earlier? We have to understand the long-term needs of drug endangered children and implement appropriate and effective intervention strategies. So we know that these children growing up in these environments are impacted in a variety of different ways. And so they will have emotional problems, behavioral problems, and cognitive problems. So by emotional problems, we're talking about things like anxiety, post-traumatic stress disorder, or PTSD. Complex emotions are going to be shame and guilt. Oftentimes, children don't know what to do with those kinds of emotions. Behavioral problems can include sexually acting out what they've seen, kind of that children see, children do. Oftentimes, we first get contact with a family because of those behavioral problems, whether it's at school, where they come in contact with law enforcement. And then cognitive problems oftentimes are what the schools are seeing, the inability to pick up on social cues, difficulty paying attention, being delayed. So I want you to think about this, though. If a child is being identified with cognitive problems at school age, so 5 or 6 years old, imagine that they have 5 or 6 years of missed services. So that early identification, even before they hit school age, is going to be very important for these children as well. So the importance of intervention. A report of child abuse and neglect is made every 10 seconds. So keep in mind that these are just the reports being made. We know that abuse and neglect is happening more often than that. Children who experience child abuse and neglect are 59% more likely to be arrested as a juvenile, 28% more likely to be arrested as an adult, and 30% more likely to commit violent crime. And then 2/3 of the people in treatment for substance use reported being abused and neglected as children. So what we're talking about, and what you guys already are seeing, is the multi-generational cycles of child abuse and neglect as well as substance use. So we as community members and you guys as professionals have an opportunity to make the revolving door stop or to slow it down, to do things different.
We also know that the importance of intervention is key in these efforts. The earlier the intervention, the more efficient and effective the outcomes. But thank goodness, research and clinical trends also support that potential change throughout life. So in other words, it is never too early to intervene in a child's life or a family's life, but it is also never too late to intervene.